Why would we talk about the gallbladder? Well, for one, it's common. 20% of persons in the world will have a gallbladder removed in their lifetime, mostly due to gallstones, although there are less common reasons to have a gallbladder removed, like acalculous cholecystitis, cancer, symptomatic polyps, etc. Let's get in on it.
With sturdy motion, I fix the potion that gives us our mental power.
We begin with the prenup, an intro to the info. I'm itching to get distro. This is just a window in the world of Dr. Lingo. Flashing lights at disco. Ideas come in like disco. The name is common sense, though. Not to keep this rapping, bro. This is what you don't know. I bet it's just a bro. Take it away from the show.
Well, first of all, what is the gallbladder? The gallbladder essentially is a sac. It's like a storage container that stores essentially what is an emulsification agent, like otherwise known as a soap, that emulsifies fat. So when you eat a fatty meal, the gallbladder will be stimulated by a hormone secreted from your body when fat hits the small intestines, thereby causing the gallbladder to contract, release this soapy material called bile into the small intestines by way of the common bile duct. That duct is essentially a tube. It's like a transport device that allows bile to get from the gallbladder into the small intestines to emulsify fat. And if you don't know what emulsification is, essentially, if you ever wash dishes in a sink, which I know a lot of people don't do anymore, but if you've ever done that before with some greasy dishes and you have the little bubbles that form of the fat, that's emulsification. It breaks fat into small droplets so it can be easily absorbed by the small intestines. So the gallbladder is a sac. It sits right next to the liver, right underneath the liver, right in the right upper part of your abdomen, and it stores bile that is created and manufactured in the liver. And then that bile just sits in that sac waiting for you to eat a fatty meal and be stimulated to contract, to release bile into the small intestines so you can emulsify fat, thereby being able to absorb fat. Now, you can remove the gallbladder, like as I mentioned before, that 20% of people in the world will have the gallbladder removed for various reasons. And you can essentially go about your life without any consequence to not having a gallbladder, because you still have bile that your liver can secrete, and you just don't have a large store of bile. Unless you were to go to like Red Lobster and eat like a huge fatty meal, you really won't have any consequence to it. If you ate that fatty meal, the only thing that would happen is that you would have like a loose, oily stool because you would not have enough bile to emulsify all of that fat. Thereby, the fat would then kind of go through your intestines, causing an oily diarrheal mess, essentially. Not a huge deal, somewhat of an inconvenience, I'm sure, but not a huge deal. Gallstones, people always want to know, okay, what are gallstones? They're basically a crystallization of the bile, either due to an imbalance in the components of bile. The bile is, again, a soap that your body makes. So if you have to imbalance on one of these, like too little bile salts, too much cholesterol in there, then they can crystallize. It's basically a chemistry process. And then you have these stones. So those stones, when they try to get out of the bile duct, which is too small for stones to get through, or even if it's large enough for it to go through, it still causes a temporary obstruction or blockage of the bile duct, causing the pressure to build up in the gallbladder upstream and causing pain. And that pain typically is you feel it in the right upper part of your abdomen, right underneath your right rib cage, where typically people will feel the pain. Classically, that pain will radiate, or it will kind of shoot to the back or to the right shoulder. And the reason is because of the gallbladder kind of sits right underneath the liver. The liver and the gallbladder both are kind of right up against the diaphragm, and you have nerves, a nerve called the phrenic nerve that connects to the diaphragm, and that nerve comes from your neck. So when you'll have this referred pain to areas that those same nerves go to, that's called referred pain. So like your right shoulder, your right upper back area, classically. Although many people will have chest pain that they relate to their heart, or they'll think they have severe indigestion when actually they're having what we call biliary colic or gallbladder pain from gallstones. The typical classic risk factors that we are taught in medical school and physicians kind of think of when you think of the typical or prototypical person that will have gallstones, that you would suspect to having gallstones when they come in with abdominal pain or what we call epigastric pain, which is upper abdominal pain, or specifically right upper quadrant pain that radiates to the back, then are the 5 F's. Well, being overweight or fat, to make the acronym easy to remember. Female, because estrogen is a risk factor for gallstones. Familial, meaning that if you're in a family where a lot of other people have gallstones, your mother, your father have gallstones, then that's also a risk factor. Fasting, so somebody who has been on a new diet, not eating a lot, not eating a lot of fatty meals. This is a classic situation of somebody who's critically ill in the ICU, who's not eating a lot and or not eating at all because they're being fed either intravenously or they're not getting much nutrition. Specifically, they're not getting a lot of fat, so the gallbladder is static, meaning it's just sitting there. Then the bowel's just sitting there, it's not ever moving. Then that is another reason. So far you got fat, female, familial, fasting, and fertile. Fertile meaning because, again, going back to the female part, that estrogen is a risk factor. So during a woman's reproductive years, their estrogen levels are higher, or if they're taking birth control pills, which also increases estrogen, that can be a risk factor for gallstones. So that's kind of like the rundown on what gallstones are, what gallbladder disease is in general, the most common type, which is gallstones. We can go a little further in this in another episode. Don't forget to subscribe to be notified when we drop new Dr. Keith episodes. And please post any questions you have about this episode or any other medical questions in the comments.